ability when we come back all together, like these conferences when we're all together and we get that chance to kind of interact and connect with people, it's so important. Now, for this final section, it is my absolute privilege to introduce you to someone. Now, she actually needs no introduction because I'm sure many of you already know her. But let me tell you a little story. I first encountered Maureen Bisognano, I was thinking back, probably 15 years ago. I was a much younger man there. I think I probably had even darker hair than I've got just now. But I was in the beginning of a journey, and I was starting to become really interested about system change and actually what we needed to do to make the change that somehow we were trying to form in our heads, but we didn't quite know how to articulate or how to go about bringing about that change. And I had the pleasure of, at that point, beginning a journey of learning on the Scottish Patient Safety Fellowship. Now, at that time, IHI were very close partners with the NHS in Scotland in relation to that programme. And Maureen was absolutely integral to that partnership. She was, at that point, if I remember right, the Chief Operating Officer, but she subsequently became the President of IHI after that. She's a leading world figure in healthcare system and improvement. And we're very fortunate to have her with us today. But what we're going to hear from Maureen today is about the area that I think she feels most passionate about. It's very evident from the work that I've seen her do over many, many years and heard her speak about many, many times. And it so resonates with what we're trying to do in Scotland with realistic medicine. It's about actually putting people at the centre of their care, about ensuring that actually the care that we're providing is fitting for their preferences and their goals, and actually looking at things in a different way. So it's my great pleasure in kind of introducing Maureen Bisognano today, and I look forward to hearing what she's got to say as much as everyone else in this room. Maureen.
Oh, thank you so much. And I can't tell you how excited I am. When I was reading through all the work that you're doing and getting ready for today's session, the words that came into my mind were energized and excited and enthusiastic. And I'm just delighted to connect with you all, because the work that you're doing is in my mind and it's in my heart. And I looked through all the work like co-production and looking at social prescribing and how do we use AI and how do we focus on patients? How do we support our workforce? Everything that I read that you're doing just ignited my passion for this work even more than I ever have before. So I'm very grateful to be invited and be able to share with you today. And I want to talk, first of all, about how do we really focus on people and how do we really get to know them in a complete, perhaps even a different way. You heard my introduction, so I was COO and then president at IHI for many years, and you hear all that stuff. But there are a few things you might not know about me. I'm a grandmother. Jack and Annabelle are the cutest kids in the world. I know you might not agree, but they are. And my husband, Chuck, and I got married 23 years ago in Machu Picchu in Peru in Spanish after doing the Inca trek for 5 days. Neither of us speak Spanish, but we are married. And I have a kind of a spirit of adventure. So you might not know that I went by myself to climb to base camp on Mount Everest. And then I went to Africa and climbed to the top of Kilimanjaro. I've been to all 7 continents, and every year for Christmas, I give my family an adventure. So we take an adventure somewhere in the world, because I think those kind of memories are even more important than gifts and things. But my most favorite day of my life so far, Chuck and I played golf at the old course at St. Andrews. And it was like the most incredible. We play golf every Saturday morning, but that day is so special, and we both think about that. So hopefully you learned something new about me that you didn't know. But that's what I want to focus on today, is how do we think about learning to see in a different way and to hear in a different way. so that we can really focus on total people, not just what their disease is. I learned this many years ago, and some of you may have heard me tell this story, but this is my mother. I'm the oldest of 9 kids, big Irish family with a little Scottish blood too. And my mother, shortly after I took this picture, had a stroke and was admitted to the intensive care unit and was intubated and all kinds of feeding tubes and the like. And I remember this incredible day where she had been in the hospital for about a week, totally unconscious and unresponsive. And the doctor, her doctor, asked if we could have a family meeting. Now, you can imagine with the size of my family, when everybody comes to my house for Easter a few weeks ago, there were 63 people. That's my immediate family. So we had a big conference room, and the doctor said, "Tell me about your mother." And so I said, "She's 78 years old. She's got diabetes. She's had bilateral knee replacements." And he put up his hands and he said, "No, tell me about your mother." And my brother, Stephen, who's the trouble one in the family, he said, "I'll tell you about her. She loved me best. She called me every day and told me that I was her favorite and she loved me best." And we all started laughing. For an hour, we laughed and cried and laughed and cried. And that doctor and her nurse sat there with us. It was the most incredible experience to tell them who my mother was. Right near the end of the hour, this other doctor walked in and he stood up and he said, "Your mother is never going to wake up again. I'm going to have to put a trach tube in and a feeding tube. Good luck finding a nursing home that will take care of her like that." But that's what's happening. And so my brother, Stephen, the troublemaker, said, "Oh, because my mother's dying, she's not your patient. She's not your," and I looked at those 2 doctors, one sitting with the family and the other standing with the clinical diagnosis. And I said, "This doctor is the doctor for her soul, and that doctor is the doctor for her body." And I didn't understand why it had to be like that. We took my mother home. We had her home for 2 weeks when we all gathered around her and helped her to have the greatest death. But those moments, another moment while she was in the hospital, the CEO of the hospital, who was a friend of mine, came up and he said, "Is there anything I can do for your mother?" And I said, "No, unfortunately, there isn't." And he said, "Is there anything I can do for you?" And I said, "Yes, you can stop visiting hours. You can stop keeping me away from my mother. My mother's dying. We need to be with her." And he said, "We don't have visiting hours." And I said, "Oh, yes, you do." And he said, "No." He said, "We never keep a patient and their family separated." So I said, "Come with me." And we walked up to the unit, and this was the door to get into the unit. Big stop signs on it. The door's locked. 24 hours a day, you had to call in on a phone. And of course, being a quality nerd, I kept a little run chart of how many times they let us in. And it was about 10% of the time. Other times, they had covered those glass windows so you couldn't see. They would say the doctor's making rounds or somebody's coding or come back later. And when he saw that, 1 week later, this was the door. And he said, "I never saw it." So many doctors and nurses in that hospital have said, "I walked by that unit every day. I never saw it." So what I want to focus on today is just some new ways that we might be able to see and hear, listen in a new way to our patients. You probably all know this nurse, Jen Rogers. I don't know if she's there with you today, but I was reading on the way to Paris a New England Journal of Medicine article, and in it, it said, "You can't only ask what's the matter, you have to ask what matters to you." When I got to Paris to do the plenary, there were 4,000 people in the audience, one being Jen. And I said, "When you go back, ask the first patient you meet, not only what's the matter, but what matters to you." And Jen wrote me a story about a little girl named Kendra that is still in my heart. That next week, I got stories in Portuguese from Brazil, from Australia and New Zealand, from British Columbia. People all over the world said that when they asked that question, it made a huge difference in the care. So that movement now has spread to over 50 countries. And we meet once a month on a call. It's free, it's filled with joy, it's filled with research and experiences, and we're learning so much about what a difference it makes when we ask that simple question rather than just what's the matter, what matters to you. I got a call recently from a nurse in the United States in Connecticut, and she said that she, for the first time, walked into a patient's room and she said, "What matters to you today?" And he was an elderly patient with terminal lung cancer. And he and his wife were sitting in the room. He was very near the end. And she said, "What matters to you today?" And he said, "The only thing I want is a grilled cheese sandwich." And she turned around and she pointed to the whiteboard behind her and she said, "You're on a cardiac diet. You can't have a grilled cheese sandwich." And he started to cry and he said, "I'm very near the end of my life. The only thing I want is a grilled cheese sandwich." So she went and got him a grilled cheese sandwich, and he ended up having grilled cheese sandwiches for lunch and dinner the last 4 days of his life. But he and his wife kept telling her what incredible difference it made when she asked that question and got him a grilled cheese sandwich. She was surprised because she was seeing these invisible barriers. When I ask people to do this, so often they say, "Oh, I can't, you know, they're going to ask for a Lamborghini or they're going to want something that I can't do." But look at this, 60 to 70% of staff change their practice. 70 to 80% say they learned something new because they're looking at the person, not the diagnosis. And the staff are reporting incredible improvements in conversation. So it's making a huge difference. If you haven't read this book, Compassionomics, it's by two physicians here in the United States. And they're talking about what an incredible difference it makes. They said when they first started looking at kindness and compassion, people were saying, "We don't have enough time, we don't have enough money." So they did research that showed that actually having compassion and kindness makes not only a difference in clinical outcomes, in joy in work, but it actually has a positive financial impact. They found, as an example, that if an anesthesiologist comes out of the OR before the patient gets wheeled in and says, "My name is Maureen. I'm going to be taking care of you today in the operating room. I'll make sure that you're comfortable through the whole procedure. I'm with you the whole time," and puts your hand on the patient's arm. That 40 seconds of interaction actually produces a patient who needs less anesthesia in the OR, less post-op pain medication, and has a shorter length of stay. What we're finding is that compassion is making a huge difference all over the world. I love this story from Belgium. This woman on the left, Anna May, is a film producer, and she was making a documentary about healthcare. And she kept visiting the hospital day after day. And she saw this patient, Vivienne, who had been intubated in the ICU. And Anna May was interested in what it was like, but Vivienne was intubated. But when Vivienne got extubated, Anna May went and visited her and said, "Tell me what your experience has been." And Vivienne said, "Climb into the bed with me. Look up at the ceiling. That's what I have looked at every day, 24 hours a day. The only thing I can see is that ceiling." And it really would mean so much to me if I could see something else. And Anna May said, "Well, what else?" And she said, "Can I get you anything? What would make today a really good day for you?" And Vivienne said, "The only thing I want is a mango." And so Anna May went and got her a mango and a mango smoothie and a mango. And when she brought them in, the joy on Vivienne's face was so incredible. The doctors and nurses were saying, "Why did we never think to ask what would make today a good day?" So they called it a mango moment. And mango moments now has spread all over Belgium and beyond. We're hearing people, I'm getting stories from everywhere talking about the difference that a mango moment can make. I'm going to tell you another story about what happens when you look at a patient through a different lens. This is a story of a resident in California who was taking medical students around and trying to help them to understand how to talk and communicate with patients. And they said, oh, we don't have time for that. And she said, yes, you do. Come with me. And she said, bring me to the most difficult patient on the unit. And they all rolled their eyes and said, we know exactly who we're bringing you to. They brought her to this elderly lady. They said, she only speaks in one-word answers. She won't communicate with us at all. She's homeless. We can't discharge her from the hospital because we have nowhere to send her. And so the resident walked up with the medical students around and asked this question. She said, how long have you lived in San Francisco? The woman said years and years, which wasn't one word, it was three. Where did you come from? Ireland. When did you come? 1912. Have you ever been in the hospital before? She said once for a broken arm. How did that happen? A trunk fell on it. A trunk? What kind of a trunk? A steamer trunk. How did that happen? The boat lurched. The boat, why? It hit the iceberg. The woman came over on the Titanic. And she went from, in one little interaction, from being the most difficult, boring woman in the unit to all of a sudden, everybody's gathered around the bed. She was a housekeeper on the Titanic. Tell us what happened. What was it like? How did you get rescued? What happened to you when you came here? How did you get taken care of? It was the most incredible interaction. This very brief interaction went from what's the matter with you to these simple questions. And I'll tell you, these medical students have never been the same since. Just looking at, as an example, patients through the lens of humanity. In many hospitals now, starting in Belgium, but spreading around the world, nurses and doctors were looking at young kids on the way to the operating room. And again, having read Compassionomics, they were looking at the stress of these kids. And they said, okay, we take their clothes off and put a Johnny on them, lie them on a stretcher, put an IV in, and wheel them away from their parents. The stress levels when they get to the OR was incredible. So they went to all the car companies, all the big ones, Mercedes and BMW, and said, will you make us a little car? And all the car companies did. And now the kids, when they're going to the OR, they said, okay, you have to come to the car lot and pick out which car you want to drive yourself to the operating room. And the kids are so excited. They go in and they go through it. I want the red one. No, I want the Mercedes. No. And they pick out their car and then they say bye to their parents because they're driving themselves. They're not really driving themselves. The nurses are, but they think they're totally in control. And what they found is that when the kid drives themselves to the operating room, they again use less anesthesia and less post-op pain medication because we're looking at the stress that they're under, not just the clinical stuff, but the humanity. And so this is now spreading all over the world. And to see the joy on these kids' faces is just, it fills your heart, Not only the clinical outcomes, but the humanity is really incredible. During COVID, I had to interview patients by phone, and I all over the world interviewed patients about what their journey has been like in health. This is Jackie. She's 24. She's studying to get her master's degree at Harvard and working in an insurance agency. And I asked Jackie about her health, and she said, oh, it's fine. I'm good. And so I kept pushing her a little bit further. And I said, so how often do you go to the doctors? And she said, sometimes once a year, but I don't really need to go to the doctor. I asked her about her dental health, and she said, fine, the dentist tells her everything's good. And I asked her about her mental health, and I saw that her eyes were tearing up. And she told me, when I asked her some specific questions, that she was suffering from serious depression, anxiety, and that she had actually thought about committing suicide. And I asked her, did you call your doctor? And she said, yes. And she said that the doctor said, that's something that you have to talk to the psychiatry practice about. He gave her a telephone number. She called the psychiatry practice and they said, yes, we can see you in 6 to 8 months. 6 to 8 months. And I asked Jackie, what did you do? And she said, I hung up the phone and I cried for a few hours. She called a friend who had also been through a similar mental health crisis. And a friend gave her a phone number and said, call this number. And she called the number and she spoke to a therapist on a FaceTime visit. And then the therapist gave her an app. And she started, I said to her, Jackie, like, how often do you use the app? And she said, in the beginning, it was a few times a day. And then I started to feel more in control. And then it was less than that, maybe once a week, once every other week. And then she said, after a few months, that she had also been speaking with the human therapist every couple of weeks. She said that the therapist said to her, I'm going to go on vacation, so I won't be available for a few weeks. I'm going to get you connected to someone else. And Jackie said, you don't need to. I'm in control. I can wait till you get back. And she said it was an amazing experience to go from where she was to where she felt like she ended up with the therapy, which was all virtual and partly via an app. So all of my interviews with all these patients led me to think that we need to redesign healthcare around these four things. And as you're thinking about new ways to design care there in Scotland, think about these four T's. Tempo, how frequently are we doing interactions? You know, we've gone from annual visits to really thinking about tempo as being much more frequent. Every patient I talked to said tempo needs to change. Touch, we used to think you have to wait and come in for an in-person visit, virtual visits, apps, all kinds of technology now. Patients saying they love it. They don't need a personal in-person visit. Any kind of interaction for them is helpful. That's the touch. Teamwork. They told me that the healthcare system does not have great teamwork. They suggested that we do some redesigning in teamwork to come up with new ways, and I'll give you some examples of that. And trust, I was really struck by this word because I hadn't had it on my agenda, but the patients were saying because of tempo, touch, and teamwork, they didn't have a whole lot of trust in the system. And so I think we really need to redesign the systems to build all four of these T's. So we need to see the whole person. Then we have to map the assets of the community. And I love that you're doing this. You're really looking outside the traditional walls of a hospital and a doctor's office. I want you to spread this all around the world because your view of this is really shaping the way that healthcare is going to be given in the future. Redesign care with the four T's: tempo, touch, teamwork, and trust. And then ask patients, families, and communities what matters to you. I would say practice micro affirmations. We so often hear about microaggressions, but the micro affirmations are just as powerful. You know, sitting and listening, and I'll talk about listening in a minute, is hugely important. Just nodding and micro affirmation, touching someone's hand, those little things that let someone know you're listening to them, you hear them. That you sometimes agree with them or you don't. It doesn't matter. The micro affirmations are really powerful. And then ask staff what matters to you and act and listen to solve and share. What we're seeing in all parts of the world, especially in Scotland, is that health is now being developed and designed and improved way outside the old healthcare system. In the United States, the #1 improvement in Black men hypertension is at the barber shop. It turns out that a lot of the Black men in the United States don't still trust the healthcare system for a lot of reasons, historical and contemporary. But when they go to get their haircut every week or every other week, they trust their barbers more than anybody. So all over the country, we've trained barbers to take blood pressures. And then when the guy comes in, he'll say, can I just take your blood pressure first? Sure, of course. And they write it on a little card. If the guy gets that card signed off from his doctor's office, then the next haircut is free. And so it builds this link across the community, which is making just a huge difference because it's getting hypertension on the radar. And then the treatment is designed with the barbers. Biggest improvement in male hypertension in the Black community is the barbershops. So we really need to think outside the walls. In New Zealand, they've got a wonderful new transitional care model where they draw a map. This patient, Tamo, in the middle, is living with end-stage COPD, and his friends and Wanu, his closely connected group, you can see when you map it out here that it's a much more complicated circumstance than how do we take care of his oxygen tanks or his medication. You can see all of the different challenges that these patients are working on. And these transitional care nursing models are producing improvements that we wouldn't have measured in the old days, but now you are, and it's spreading around the world. Looking at loneliness and isolation, health literacy and knowledge. Look, they're building trust, coordination, that's teamwork. As you look at all of these improvements that people are seeing, it's dramatic changes that are coming from looking at healthcare in a new way. You also can take an example from IHI's age-friendly model, and I know many of you are working on that. But here we're looking at, again, the total system, cities, communities, health systems, universities, and looking at how do we link across public health and health systems in a new way. And you'll have all my slides to look at afterwards, but go through these and take a look at how we can use improvement tools, driver diagrams to help create an aim, and then looking at primary drivers, secondary drivers, and create a work plan that we can share broadly so that everybody can see how they fit in to the big goal of working on creating an age-friendly health system. Looking at also cultural competencies and equitable care, it's really an important aspect, I think, globally. And then how do we co-design with patients? Paul Batalden and his daughter, Maureen. Paul is one of the founders of IHI, and his daughter, Maureen, is a general practitioner. And these other physicians came together and said, it's not our job only to produce healthcare. We need patients to help us co-design and co-produce health and care. And so we're seeing, again, all over the world, people looking at it through a different lens. This is an example from Dell Medical School in Texas, where the medical students are learning all these different ways to think about what care is like. I love that in order to graduate from Dell Medical School, you have to take a cooking class, because they found that most of the medical students weren't eating healthy in their own right, never mind helping people to look at what is healthy eating. So they have to take a cooking class to graduate. But they make up these people and ask them, what's the journey like? And these medical students then take a look at what's the journey of this patient. And they look at it, well over time. They're looking at, against all the different members of the team, all the different places that a patient has to go, looking at the waits and delays. And if you look at this map, it would inspire you to think about the 4 T's, because they totally, none of the 4 T's are optimized in the current way of care. So the medical students redesign care using the 4 T's and looking at how do we create a sense of teamwork. What's really fun about this is that it's not only creating better clinical outcomes and lower costs, but real joy in the workforce there. It used to be, as an example, that the patient would check in and then wait somewhere, and then go to triage and then wait somewhere else, and then have a consult and a follow-up, and then go and come back. And when they draw that journey map, it taught them how difficult it is to try and access the healthcare system. So now, if you go to get your healthcare there in the Dell Health System, you get a room. It's your room. And you get assigned a room, and people come to you there. They come in teams, but the patient is actually watching the whole journey as they go through the care. They give them a boarding pass when they come into the, upon arrival, and it tells them, your room is ready, this is where you're going. And there's a little tear off down at the bottom so that they can give it to their family, so that when the family comes in, they'll know exactly where the patient is, they'll know exactly where they are. I love that you get a boarding pass to get into your hotel room, your hospital room. It's more like a hotel room. And so I think we're starting to see some dramatic improvements. What I like most about the work that you all are doing is that, first of all, you're looking at the health challenges in Scotland. You're looking at all of the issues that are facing the public, and how do we work together to get Scotland to be the healthiest country? How do we work together to create a great workforce? How do we look way beyond the walls of a hospital or a doctor's office and look at the social determinants of health, and do as you were hearing this morning about social prescribing? Because that data, those challenges can really help to drive the kind of changes that you're working on now, but the rest of the world needs to hear about. Now, I know that there are some dentists in the room, and what I'm so excited about is your program called Child Smile. I haven't seen a whole lot of focus on this in the rest of the world, so I want to help you to spread this, because what we're looking at, I think, as you know, that the two biggest preventable diseases in the world are dental decay and gum problems. And so when you look at the Child Smile program that you have developed, it's really in dental decay, an equitable disease, because it's in the worst of populations. I mean, I have visited countries all over the world and found that in many countries, kids have never brushed their teeth. They don't even know about it. Well, you can predict what the impact on their health is going to be. So the three elements that you dentists in the room have built, looking at dental practices with oral health educators, incredible. Looking at schools, and I love those little carts that you've got with the toothbrushes in it, so that the teachers are telling the kids at lunchtime, after lunch, you've got to brush your teeth. And then really focusing on the parents. I think that this work is incredible, and really, I think, teaches all of us that putting mental health and dental health into the definition of total health is going to be critical. Now we're seeing, I'm on the National Academy of Medicine, and National Academy of Medicine is picking up examples like yours and writing papers now on whole person oral health education. So the work that you're doing is not only having an impact there on little kids, but I bet it's also spreading to their parents. When the little kids are learning about it, they start to teach their parents. And I think that's a way for us to think about impacting total health. And then the other favorite story I have from Scotland is your work on the Daily Mile. And I remember years ago visiting in Stirling, the very first class where the Daily Mile was. I remember the teacher telling me that the Earl who used to come down and sit in the first and second grade classes, and he'd teach them poetry and music. And but I remember he one day told the teacher, he said, "These kids are fat." And she said, no, it's not my problem. All over the world, from Chile to Africa, I've asked people the same question to healthcare professionals. What do you do when you've got childhood obesity as a problem? And they say, we see the kids once a year. What can we do? So learning about how to go to the teachers who see the kids almost every day is a much more effective way to create fitness in kids. In Chile, as an example, the teachers were trying to work on childhood obesity, which was an epidemic there. And they were trying to get the kids to drink water. So the teachers would put 3 big plants on their desk. And every day in the morning, in front of the class, they'd come in and they'd pour water into one, they'd pour Coca-Cola into one, and they'd pour nothing into the third one. And the kids every day would watch the one that had no water and the one that had Coke die, and they'd watch the one that had the water thrive. So we're starting to see that schools have a greater impact on pediatric fitness than pediatricians do. And I love how the Daily Mile is looking at not only physical health and obesity, but really figuring out how this can help their mental acuity, how they can create more emotional strength and their fitness. So if the Daily Mile hasn't spread to all over the country, I would ask you all, because you're the ones to do that. I'm helping to spread it to other countries. It's wonderful to see other countries picking up the Daily Mile. If you walk into schools across the United States, you'll see teachers taking their kids out and running a daily mile, running around the school however many times it takes. And then predictably, the kids go home and say to the parents, did you run your mile today? They're getting the parents to run. So we're starting to see incredible benefits when we look outside the walls of health care on health. And I want to also say that asking what matters to you is having a tremendous impact on patient experience. That's something that more and more healthcare systems are measuring, not only clinical outcomes and cost, but what's the experience like? And we're finding, again, all over the world, that when we're asking staff what matters to you, that when you ask and you act, that we're finding incredible improvements in joy in work and increased retention, dramatic improvements in decreasing turnover, and really creating a sense of partnership. Leading with compassion has these incredible research-based benefits. Employees' decision to stay in their job largely comes from a sense of being valued. I have to say, although I'm sort of compassionate by nature, I don't remember learning how to build teams or how to be compassionate in education, but we've got to really create a culture where compassion and leadership really focus on the well-being of our staff. You may have also seen this other movement that Bob Klaber, a pediatrician in London, and I started some years ago called Kindness in Healthcare. And we started this because we were doing a big session at one of the IHI BMJ forums on kindness. And we had so much fun planning the session that when it came to actually doing the session, at the end of it, we said, we've been meeting once a month, and we've been learning so much about the clinical, the social, the impacts of kindness in healthcare that we're never going to stop meeting. So again, this is another call. We meet once a month, free, filled with joy and research outcomes. And I'll give you the links at the end of the call, but it's making a huge difference. People get up in the middle of the night to come to the kindness calls because of the impact that it's having. And we're looking at from a research perspective, when we focus on human experience, and that's patient, family, workforce, and organizations, that there's an incredible value case when we focus on this. When we look at numbers only or numbers first, certainly you may see some improvements in bottom line, but here we're looking at total integrated impact. And so I would hope that you would start to think about this picture as maybe something on the wall that helps you to think about, how do you plan your day? What am I going to do tomorrow? What am I going to say tomorrow? Because everybody's watching us as leaders, what we do and what we say. And then how do we listen? So we've been working on this listening arc, which is, as you saw from my first example, seeing the door was powerful. Listening is too. And again, I think we've got to really help people to understand what's the best way for us to listen. It isn't just sitting there when we've got so much going on in our mind, or we keep glancing down at our phone. Listening, it turns out, that is a leadership skill that we really all can benefit from and focus on. I was recently talking to a young environmental services worker at a hospital, and he was telling me, I told him, we were talking about his life, and he said he had been called to the HR, the Human Resources Department, and told he was fired. And he said, why? And they said, because you've been absent too much. And so he went down to start to clean out his locker. And one of the other environmental services workers said to him, what's the matter? And he just turned to her and he started to cry. He said, I've been fired. And she said, why? And he said, I called in sick too much. And she said, why? And then she had heard all over this hospital, people saying, what matters to you? She said, what matters to you? Why were you calling in sick? And he said, I'm going through a terrible divorce. And if I don't go to court and fight for custody of my 5-year-old son, I will lose him. And he's what matters to me. And he started to cry again. So the other environmental services worker put up a piece of construction paper on the wall. And I know I have a bad Boston accent, but an art kit, ART, some crayons. And she picked up the construction paper, and she said, she drew a little grid with all of the environmental services workers. And across the top, she said, what matters to you? And she started to make a schedule out of what matters to them. And then afterwards, they found that they could do that. So she went to the hospital CEO and she said, if we promise you that we won't cost any more money to staff environmental services, and we will cover every single day well, will you let us make the schedule? And he said yes. And it has been such a powerful change, not only in housekeeping, but all over the hospital, because staff have so much going on outside their work. And when we just tell them to show up and they can't, they call in sick, it causes all this disruption. But when we ask what matters to people, it can make a huge difference in the way that we work. So look at these levels of listening. And I'd ask you, as you go through your day, to think about these. Are you listening with one, from habits of judgment, like you're already thinking about what you're going to say, or factual listening that opens your mind, you're noticing differences, or empathic listening that opens your heart, or generative listening that opens your will to change. So I think these are really very powerful and important ideas. And then Steve Swenson, my colleague from Mayo Clinic, talks about these as being the real drivers for people-centeredness, agency, positivity, belongingness, and collective effervescence. The agency is, I have some sense of control, just like those housekeepers did in making their schedule, just like these home health nurses in the Netherlands created a whole new way of providing home care that they call buurtzorg, neighborhood care. They were all quitting, and when they took over control of how they took care of patients, patient care improved, turnover decreased, that sense of agency, like we're working together to do our jobs well, and totally turned around home health care, saved billions of euros, huge impact over time. Steve always talks about commensality. The most important driver we can have in our daily work is commensality. That means eating together. When we find that people are all by themselves with stress, at Mayo Clinic, they started to give physicians a very small amount of money if they would eat together. So some of them would say, okay, I'll meet you for breakfast, and some for lunch. But at first they gave them an agenda, and they found that it had such positive impact on the teams that it just became the way of life. And everybody at Mayo Clinic does commensality now. It's an incredibly important way for us to think and look. Collective effervescence is when we all come together and we can create a sense of joy. And ikigai, craft your life. It gives you a sense of control, like we can design our lives if we want to. And then the importance of curiosity. Work on your IQ, your EQ, and your CQ, your intelligence quotient. Every week, think, can I learn something? You're all learning today. Can I read an article? Can I watch a video or something? Emotional quotient, walk in the shoes of people, and curiosity. Where I learned so much from other industries, from when I'm at a grocery store, that ways that we can improve healthcare. So I'm going to show you a brief video.
Doctors and hospitals really aren't what we call conversation ready, because we ourselves have so medicalized everything that I'm seeing for this patient. What's the dose of this medicine? What's the chemotherapy or not? With this test or not? That we ourselves don't actually often have the experience, the practice, the support that we need to sit down with the patient as a human being, understand what's important to them as a human being, and make sure that that's always at the center of every medical plan. I was asked to see Thelma Botello. All that I knew was she was a 92-year-old woman who had severe vascular circulation problems in her leg, causing her lots of problems, for which there wasn't going to be any effective treatment that they could offer except amputation, which she just refused. She wasn't going to have that done. And so they said she didn't have that long to live, and so they wanted me to come by and maybe talk to her about hospice kind of options.
What I remember, I guess, most strikingly was that Dr. Farrow asked her, what would be a good day for you?
And so I sat down on the bed. I said, getting to know you some as a person will help me figure out how I can best help you.
And it's such a simple question. What would be a good day for you? What do you like to do? These things that I don't feel like I have time, honestly, on a daily basis when I'm seeing patients, when I'm on call, to ask these little things.
In whatever time there is ahead for you, how can we make that as good as it possibly can be for you? Singing is what made it a good day.
But it didn't take that long to find out that this is what was important to her.
I said, when was the last time that you sang? And she just sort of said, I haven't sung in a long time. I don't sing anymore. I said, why not? And she kind of looked at me and I said, how about singing me a song?
I see trees of green, red roses too. I see them bloom for me and for you. And I say to myself, what do you say, darling? What a wonderful world. Somebody, where's the drummer?
I see skies of blue,
I see skies of blue,
clouds of white,
clouds of white,
the bright
the
blessed
bright,
days,
blessed
blessed
sun, and the dark, sacred night. And I think to myself, what a wonderful world. And I think to myself, what a wonderful world. Pop, 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 pop. Oh, yeah.
And it made such a huge difference in her day.
The music was right there as vividly as it had ever been. And every time her voice started to sing, you could just see her eyes getting younger, her face getting younger, and a kind of human joy returning.
So I think you can see, I hope you loved that as much as I do, the difference between the asking that simple question and how you see the patient. It was like the lady who was on the Titanic. When you look at Thelma Botello, or Dolly Baker was her professional name, she was a jazz singer all over the world. She was world famous. And when we were making the video, she actually told us that she had had a big fight with her husband once because he had an affair with Marilyn Monroe. I mean, that's who she was. And she wasn't a 92-year-old lady with bilateral leg ulcers. But it's really understanding who these people are that makes such a huge difference, I think, in all of the work that we do. And just so you know, that doctor in that video, he was the doctor for my mother's soul. He was the one that sat with us for the hour. That's him. And it really made such a huge difference. We're still in touch after all these years because we're working together on trying to get his heart spread across the country here. So I'll leave you with a couple of tools, I think, for Thriving Now. I always say you can't give what you don't have. You've got to take care of yourself. So everything I've been talking about, Ikigai and collective effervescence and all, it starts in here, and you've got to really work on that. So build your psychological PPE. Ever since, specifically in COVID times, we've been talking about personal protective equipment, but we also need psychological personal protective equipment, really taking a look at how we take care of ourselves. I'll give you this little map of promoting mental health and well-being for yourself and as a team leader, how you can, some tools for doing this better. And then I would say exnovate to innovate. I don't know if exnovate is a familiar word. It's one I've been using a lot, but it means to get rid of all the stuff that adds no value. And always people tell me, I don't have time to innovate. But if you exnovate first and get rid of things that don't add any value, it makes a huge difference. My husband tells me I'm not good at exnovating my closet, but I'm working on that. Make a to-don't list instead of a to-do list. What are you going to stop? When I was president at IHI, I took a white wall that you could write on, and I wrote across the top of it, GRRRRR. And I said to the staff, anytime you find yourself saying grr during the day, write on the wall what made you say that. Within a week, the entire wall was covered. And it gave me my list of improvement projects, because if you don't call them out, people just say grr and they live with all that. But you can really work on improvement to make people's lives easier. Plan to learn to see, do some journey mapping, try and make an appointment and see what that's like. You know, I think all of these experiences can really help us to work on our psychological PPE. And then I had the great opportunity to meet the Dalai Lama and spend some time with him. And there's lots of quotes that I think about every single day, but I love this one. If you want to be happy, practice compassion. If you want to be happy, practice compassion. I've learned so much about empathy as being the part of your brain that helps you see someone's in pain, but compassion and kindness, when you act on that, is what brings you happiness and joy. So I'll end with this, and you can see the links to the whatmatterstoyou.world and kindnessandhealthcare.world there at the bottom. Hopefully you can join in on our monthly calls, and you'll have all of these slides, and you're welcome to share and use them in any way. So thank you all for your time so far today.